Hello, everyone. Welcome to the Facebook Live session organized by Metro Group of Hospitals on the occasion of World Liver Day. Today, we have a panel of five expert gastroenterologists who will cover important topics related to liver health. Our panelists have extensive experience in their respective fields and are renowned for their expertise and contribution to the medical community. First, we have Dr. Harsh Kapoor, a well known gastroenterologist in India with over 35 years of experience in the field. He obtained his MBBS degree from the University of Delhi and Canadian Board of Gastroenterology and Hepatology degree from Dalhousie University, Canada. Dr. Kapoor has been honored with various awards, including a Dean's Award in Teaching Residence at Dalhousie University, Canada. Next, we have Dr. Ankur Garg, Director Surgical Gastroenterology and Liver Transplant, Metro Hospital, Noida and Faridabad. He's one of India's foremost surgeons with a super specialization in MCH, HPV surgery, and liver transplant from the esteemed Institute of Liver and Biliary Science, New Delhi. Dr. Garg has a cumulative experience of more than 1500 plus liver transplant and complex GI-HPV surgery. Next, we have Dr. Vijay Verma, Dr. Vijay Verma, Director Medical
Vijay
Gastroenterology
Sharma
and
sir.
Hepatology, Metro Mass Hospital, Jaipur. He's another expert in the field. He completed his MBBS from SMS Medical College, Jaipur, followed by an MD in General Medicine from RNT Medical College, Jaipur. He then pursued a DM in gastroenterology from Sanjay Gandhi Institute of Medical Science, Lucknow, and a postdoctoral fellowship at the University Hospital in Denmark. Next, we have Dr. Uh,
Vishal Khurana.
So one second. Next, we have Dr. Vishal Khurana, Senior Consultant Gastroenterology for Faridabad. He is another highly experienced gastroenterologist in Faridabad. He completed his MBBS and MD Medicine from the Institute of Medical Science, BHU Varanasi, and DM Gastroenterology from the Institute of Postgraduate Medical Education and Research. So, hello, doctors.
Hi.
So,
Hello.
yeah. So, my first question to Dr. Harsh. So, what is the importance of the liver in our body and its role in overall health?
Liver, as you know, is a vital organ in the body. And when I look at liver, I look liver three organs in one. One is to detoxify and break down the toxins. Second is to transport, like bilirubin is carried away. And the third is to produce some essential things for clotting, uh, factors, and albumin, and bilirubin is also synthetic. So when we look at the liver problems, we look at the different composition of the work it does, and then we think about what can go wrong with this. The other thing I would like to add is liver is a huge organ. God has made a kilo and a half. But even if the 10% of that is working, you can live very nicely. But once that 10% is touched, then you go down very fast. And more than treatment, you'll be looking at liver transplant at that moment. And this is the only vital organ which can regrow back, and it's a very forgiving organ. We should deal with the liver very, very carefully.
Thank you, sir. My next question to Dr. Ankur. Sir, what are the common risk factors for liver disease and how can they be prevented?
So, talking about risk factors, though the list is endless, but if we talk from a common man's perspective, the most common risk factors are, of course, alcohol intake. We are all aware of hepatitis viruses, which is again a group of five viruses. Again, that is a common risk factors, and depending upon the virus, their transmission depends whether it can be a normal food, water contamination related to blood transfusions, or sharing of needles and syringes. So, depends upon what type of hepatitis virus we are talking about. And of late, if we see in last 15, 20 years, there's been a dramatic increase in the incidence of fatty liver, or what we call as non-alcoholic steatohepatitis, which is all attributable to our lifestyle, be it food patterns, be it our physical activity. And as of today, around 15 to 20% of the liver transplant across the world are being carried out for fatty liver related liver failure. So, talking about risk factors, though liver being a very resilient organ and has got a good reparative capacity, So alcohol intake, diet, and hepatitis infections. From a common man perspective, these are one of the most common risk factors for most of the 80 to 85% of the liver diseases. Apart from that, there is an endless list. So it will never end if we keep talking about it.
Oh, thank you, sir. So, Dr. Vishal, can you explain the different types of liver diseases such as viral hepatitis, fatty liver disease, cirrhosis, and other liver diseases and their causes?
So, if we talk about the liver disease, we can divide the liver disease according to infectious disease or oral ingestion of alcohol, certain medicines, and certain congenital diseases. Alcoholic liver disease and non-alcoholic fatty liver disease are the basically the most common causes of liver disease in India as well as in world. Regarding viral hepatitis causes of liver disease, viral hepatitis can be divided into two basic categories. One is foodborne and another is bloodborne. Hepatitis A and E are food or waterborne liver disease, viral hepatitis, and hepatitis B and C are basically blood or unprotected sexual activity induced liver diseases. And basically, hepatitis A and E are self-limited, and B and C needs treatment. Regarding certain medicine, there are few medicine which can cause fatty liver disease, and there are certain congenital disease which can cause liver disease from the birth as well as.
Oh, thank you, sir. Dr. Vijay,
Yeah.
so what are the early symptoms of liver diseases and when we should seek medical attention?
Um, that means, like there are, as Dr. Vishal has explained, there is like acute hepatitis, different etiology of hepatitis. So there are acute hepatitis or chronic hepatitis. So acute hepatitis patient will come with recent fever, viral prodrome, body ache, malaise, sometime vomiting, diarrhea, pain, abdomen. Those symptoms they consult a doctor. Blood test is done that suggests high SGOT and SGPT liver enzymes. Then we like show that it's a hepatitis. Then we do workup for acute different viral infections and etiology of hepatitis, and accordingly we manage them symptomatically and conservatively. I mean, in chronic hepatitis, like the patient can come with history of months or maybe even 1 year history of chronic fatigue, like body ache, malaise, early tiredness, sometimes heaviness of the head, limb pain, poor food intake, anorexia, sometimes pain abdomen, fullness in abdomen, feeling of lump in abdomen, maybe enlarged liver. They feel like something is like enlarged in the right side of abdomen. They can feel like there's a abdomen is distended. Sometimes if the disease is more advanced, if like it is in the stage of liver cirrhosis, early cirrhosis or late cirrhosis, they can come with edema in feet, early bleeding from nose, maybe from gums, from little trauma, sometimes urinary problems, indigestion, diarrhea, uh, headache, sleep disturbance, many other things, even mild jaundice, pallor, anemia, all those things are also possible. So accordingly, patients should be aware of these symptoms and they should consult a hepatologist.
Thank you, sir. Uh, Dr. Harsh, how is liver disease diagnosed and what tests are commonly used?
So, I think in any medical disease, a good history is very important. So, when a patient comes to you with the symptoms Dr. Vijay and Dr. Vishal has told us, we should take a good history to see whether these things fit into any box of liver problems or not, and a physical examination that will support the clinical history, and you will have a momentum to come to some kind of a conclusion that you are leading towards a liver problem. Once you've done that, then you will start doing some basic blood work. The basic blood work will include CBC, LFT, INR, KFT, a abdominal ultrasound, and depending upon what you see there, you will proceed further. When you see LFT, as I told you, I see a liver, three organs in one organ. I look at a complete liver profile and I try to see whether it is a hepatitic picture. That means the liver cells are under pressure or irritated, or a cholestatic picture where the biliary drainage system is either internally or externally blocked, or this is some kind of a malignant thing can happen there, which can obstruct a part of the liver, and a lot of LFTs can be normal. And then we are looking at the markers for those kind of cancers in that. The ultrasound is very helpful to tell us whether there is any obstruction in biliary system, gallbladder stones, and if you are suspecting any extrabiliary duct symptoms outside the liver, then you can proceed further with MRCP, and also you can look into CT scan for those kind of things. At the same token, keeping in mind the age of the patient, if it's a very young patient, we'll be thinking more of a congenital kind of a things. And if it is more of an elderly guy, and we will be looking more into the consideration of acquired or some of the diseases which can be through infection, alcohol, autoimmune, metabolic, those kind of things. Last but not the least, you should keep in mind whether it's male or female alcohol intake. If you take more of that, then you got to accordingly order the tests which will fit into those kind of a categories. So these are the basic things you will start, and then you will keep on expanding depending upon which way these diagnostic tests are leading you to.
Okay. So, Dr. Ankur, what are the treatment options for liver diseases, including lifestyle change, medications, and then interventions such as liver transplants?
So, see, the treatment option for liver disease depends upon what kind of liver disease are we talking about. Of course, if you're talking about fatty liver, or or mild alteration in liver functions because of obesity, diabetes, so definitely they need lifestyle modification. If you're talking about alcoholic liver disease in the early stages, of course, cutting down on alcohol comes as a lifestyle modification only. Coming to medications, yes, if it is viral hepatitis, for hepatitis B and C, for both of them now, very effective therapies are available. And these are not the only list of viral diseases or alcoholic liver disease. So, depending upon what is the baseline cause of liver disease, medications will differ. Coming to liver transplant, see, liver transplant is the end resort whenever, due to any of the etiologies, there is a liver failure. So liver transplant will come into option, whether it is alcohol-related liver disease, whether it is hepatitis-related liver failure. So liver transplant is as a final stage, will be as is an option when patients go to end-stage liver failure.
So, Dr. Vishal, as Dr. Hirsch said about the alcohol consumption, so can you please describe like how this alcohol consumption affect liver health, and what are the recommended limit for alcohol intake to maintain a healthy liver?
Yeah, that's a very nice question. Alcohol, as you know, is a very common entity which most of the people consume without knowing the harmful effects of it. And basically, there is no fixed millimeter or a gram of alcohol which is safe to be consumed. And apart from affecting the liver, alcohol can affect many other organs, and it is the cause of many cancer also. So limiting the alcohol to minuscule amount, and that should be taken very rarely and only occasion, not on a regular basis, and never on fasting state. And alcoholic liver disease is a continuum of process. It can progress from simple fatty liver disease to alcoholic hepatitis, and later on, alcohol can cause alcoholic cirrhosis also. And as you know, cirrhosis is mostly irreversible process, and alcoholic fatty liver disease is a reversible process. When you stop alcohol, when you abstain from alcohol, a fatty liver disease can reverse. When it goes into hepatitis phase, stopping alcohol, it can reverse, but it is not hard and fast that it will reverse fully. So, limiting the alcohol to a very minimal amount and stopping it once you are diagnosed with fatty liver or alcoholic hepatitis stage, and so that you can stop the progression of the disease. And there is no limit beyond that, if you consume any amount that is harmful to the liver as well as other organs. You are muted.
sorry, I just. So, Dr. Vijay, are there
Yeah.
any specific dietary recommendations for maintaining a healthy liver?
Most important, after alcohol, the people there is more intake of fat, rich food, junk food, excess carbohydrate rich food, fructose syrup based stuff, food stuff. So, and healthy diet means more of complex carbohydrate, more of vegetarian food, dal and all kind of vegetables, salads, fruits. They are healthy for liver. Even dry fruits are also healthy for liver to some extent. So avoiding the junk food or bad food like fried food stuff too much and like burgers, pizza, all those things which contains maida, and they should be avoided. Second, excess amount of sweet things which contains fructose syrup or even sugar as such, and fatty stuff, those should be avoided. Regular exercise, regular walking with healthy food intake, that is good.
Okay, so Dr. Harsh, can you discuss the link between obesity, diabetes, and liver health, and how can weight management and blood control, blood sugar control impact liver health?
So now you're coming to this triad, which is very common: hypertension, diabetes, heart problems, and hyperlipidemia mainly, which is going to mobilize the fat into the liver. And this is going to happen same as if the alcohol is mobilizing the fat into the liver. And fat excessively in the liver will cause irritation of the hepatocytes, their destruction, production of AST, ALT going up, and gradually, subsequently causing scarring and destruction of the function and the passage of the substances through that. Now, the fat, let's take one by one. The fat. The lipid profile, if you look at, it has cholesterol, which is a good cholesterol, HDL, a bad cholesterol, LDL. What happens? The bad cholesterol takes fat to the liver or to any end organ, and then the good cholesterol will bring it back. If you have more bad cholesterol, you're going to go and deposit there and not going to bring it back. So gradually the fat will increase there. Hypertension. This is going to harden the arteries, the pressure will go up, and if you have too much fat already there, this is going to change the system there, and people are going to then need more and more medications at the different target organs to bring it down. Diabetes, again, high sugars are going to increase the calories. If it is not well controlled, more fat into the liver, and non-alcoholic steatohepatitis will become a disease then when you will have more destruction there. The biggest, uh, I would say, the biggest thing which has happened for hepatologists is this fibroscan new machine, which can tell us how much actually fat I have there. And like you measure weight in kilograms, the fat you can measure with caps. Up to 250 caps, it's considered normal. Anything more than that, it means you are accumulating more fat there. And this triad, which we are talking about, diabetes, hypertension, hyperlipidemia, is going to take this number up. And if it is not controlled well, you're going to destroy gradually liver, and then your LSM, liver stiffness measurement, will also go up. So it is a complex, very difficult, but if taken carefully, you can avoid a lot of complications to end result of causing cirrhosis.
Thank you, sir. So, Dr. Ankur, what are the challenges and advancements in the field of liver disease, including the new treatments and technologies?
मारा गया सब स्टैटिक हो गया ना उसको कट
So,
नहीं गया होगा हमारा
Dr. Ankur, can you hear us? Can
yeah
you
yeah
hear
I
me?
can hear you now.
Yeah,
I can
so
hear you now.
what are the challenges and advancements in the field of liver disease, including the new treatments and technologies?
So honestly speaking, the challenge, the biggest challenge is acceptance of a patient that he has a liver disease, because liver has a lot of functional reserve. So unless somebody his liver is not gone beyond 60-70% damage, most of the people will have very mild symptoms. So when they present to us, they are already in advanced stages of liver failure when they present to us. So for first of all them is the acceptance, because they say 2 months back or 3 months back I was absolutely fine. How come within 2 to 3 months I have progressed to this stage? But they fail to understand, and it is very difficult for us to explain them that even 2 to 3 months back you were sick. It was just that your liver had a huge functional reserve, so your body was functioning normal, and your blood tests were as well as normal. So I think this is the biggest challenge. Another very big challenge in treatment of liver diseases is, of course, when it comes to terminal liver failure or end stage liver failure or cirrhosis. There are no artificial dialysis machines like we have dialysis for kidney, where we can offer some support to the patients, either to buy time or either to bridge the therapy. So that is one definitely a challenge. Coming to advancements, yes, there have been tremendous advancements. First is, yes, understanding the liver disease, the diagnostic facilities. If we talk about the near technologies, the fibroscan, a very common word today, but yes, is one of the new things that has come, which helps in following up with chronic liver disease patients and to see their progress. uh, Medicines for hepatitis C, again, they are not very new, but since they have been there in the market for last 12 to 15 years, there has been a tremendous change. Now, 95% of the hepatitis C patients can be negative because of these therapies. And of course, coming to technological advancements, liver transplant is a field which has seen a tremendous improvement, and more and more complex surgeries are being done today. And the success rates are touching more than 90-95%. So definitely, there's lot of been advancements both in the terms of medical field as well as the technological advancement, which has happened in the field of liver diseases.
Okay, so thank you, sir. And before moving ahead, I would request all the participants and those who have joined us through on Facebook or YouTube, they can ask their questions or queries directly by commenting on the chat box down below, and then from there, our experts will take the questions. So, Dr. Vishal, how important is early detection and timely intervention in managing liver disease?
Yeah, it's very important point. As just said by Dr. Ankur also, if you detect liver disease early, you can prevent the progression of disease as well. So it's very important to diagnose liver disease as early as possible. Many myths are ongoing in the general people's mind that fatty liver is a common phenomena. Whenever you go for ultrasound, you will have fatty liver, but they fail to understand that fatty liver is also a disease. So if you are having a fatty liver, that is that can progress. So following up the patient who are having fatty liver so that you can prevent the disease from getting progress
I can't
is
hear.
very important. So early detection by doing a liver function test, ultrasound, and if needed, fibroscan. Fibroscan is very simple, non-invasive test which can detect your liver fat. They can quantify fat, and they can also detect the hardness of the liver. That whether you have already progressed from fatty liver to further disease. So timely intervention can be done if you diagnose the liver disease early.
Vishal, we can't hear you.
No, sir, Dr. Harsh, Dr. Vishal has answered the question. So, so I guess, are we audible?
Yeah, what do you?
Yeah.
Dr. Harsh, can you hear? I guess there's some technical issue with Dr. Harsh, and I would request my at backend team to kindly check. So, Dr. J.S. Bhogal from Metro RLKC has joined us. So, hello, sir. Are we audible? Am I audible?
There's a lot of disturbance actually. I can't hear you guys properly. Am I audible?
Yes, sir.
Audible.
You are very
Yes,
much
sir.
audible.
Hello, Dr. Bhogal, sir.
I think there is something wrong with the connection, so there is a lot of disturbance coming in between.
Hello, I can't hear anything.
Hello?
Okay, so hello. Yeah, so one second. Dr. JS, Dr. Bhogal, can you, Dr. Harsh? I guess there's some network issue.
You are
Ravi,
audible to us.
yeah, yeah. So Dr. Harsh and Dr. Bhogal can't hear us, so I guess there's some issue from their
No, no, I
end.
can hear you now. I can
Acha,
hear you
okay,
now, but
okay,
there's a lot of break. It's breaking in between.
okay. So
Hello, Mughal sir.
that's due to the network issue, and since you have joined through a
Yeah.
different lab, yeah. So Dr. Harsh, am I audible? Ravi, can you please check? So moving on to the next question. So as Dr. Bhogal has joined, so Dr. Bhogal, can you please provide tips and advice for maintaining a healthy liver and preventing liver disease?
See, first of all, I would say that maintaining a healthy lifestyle is most important, because nowadays what we all are seeing is that
Ravi,
every ultrasound which we are out of 10, at least 6 or 7 are coming grade 2, grade 3, or grade 1 fatty liver. So I think most important is lifestyle management in this case. Of course, alcohol is one thing, and then we have to take care of the drinking water and all that to prevent acute viral hepatitis A and E. So there are multiple factors, but I think for fatty liver and alcohol
Ravi,
related problems, solution is very simple, that we have to stop alcohol, and we have to follow a very healthy lifestyle, exercise, reduce our weight, keep the weight under control, so that fatty liver can be reverted back.
Thank you, sir.
मुझे नहीं सुनाई दे रहा कुछ भी.
So Dr. Vijay,
Yeah.
can you please tell what is the role of gastroenterologist in managing the liver disease and taking care of the liver disease patients?
Our role starts, we can say, from prevention, like spreading the awareness of the disease among the masses, like this kind of program. Then, if the patient comes to us and they understand their symptom, they are having problem, to diagnose the patient of liver disease, to
मैं
know the
तुम्हें
stage of
दिखाता हूँ.
liver disease, to know the etiology of liver disease, to know the pattern of liver disease and how much liver is damaged, what other complications are there by different blood tests, imaging, fibroscan, as explained by Dr. Hirsch and Dr. Ankur. So, after investigating the stage of the disease, etiology of liver disease, so we have to manage the etiology of liver disease. If there is alcohol intake, stopping the different kind of alcohol addiction as well as other addiction, stopping the medicine which is causing the liver problem. Like if there is obesity, diabetes, so diabetes management, if the patient is having other diseases like metabolic disease like thyroid or um, some ovarian problems, so all those diseases should be managed by the respective departments, and lifestyle issues should be explained to them. So managing then regular follow up the patient and the consultation of the concerned department if the patient needs special dietary management. The patient is morbidly obese and having the liver disease, they can need gastrosurgery help in the form of bariatric surgery. If they are having regular screening of the liver disease, also important by us by alpha fetoprotein, ultrasound abdomen, and fibroscan. So ultrasound to know the complication as well as the hepatoma development. Alpha fetoprotein also tells us about early like liver cancer changes. So those all those should be seen. If patients are having complications of liver disease, early complications like even if they are having less urine output, some dullness in like mentation or some early hepatic encephalopathy picture, like some mild bleeding. So early diagnosis of the complications of liver disease in the form of development of ascites, edema, some bleeding, they should be diagnosed early and managed early. So in that scenario, patient should be in regular follow-up us. And our role is to manage the liver disease, to treat the cause, and overall increasing the survival of the patient, removing the etiology or treating the etiology, and timely referral to the liver transplant surgeon and other concerned departments.
Oh, thank you. So Dr. Harsh, can you hear us now? I guess there's some network issue from his side. Dr. Harsh? Okay, so Dr. Ankur, what are the how important is lifestyle modification? This including diet, exercise, stress management, and preventing and managing the liver disease.
See, we all have, so I think, spoken in bits and pieces already about it. That till quite a lot of stage, liver disease is reversible. especially when we talk about fatty
हेलो
liver disease or even alcoholic liver disease.
क्या
So
बोला
of course
समझ
there
नहीं आ
comes
रहा
the
है
role of
मुझको
that
क्लियरली
diet
दोबारा
modification, lifestyle modification. We can prevent a lot of liver diseases upfront. Second, even if they have progressed to some stage, most of them can be
अनम्यूट कर
reversed
दें
with lifestyle and diet modification. And there comes the role that
आवाज़
what
सुन
is the
नहीं पा रहा
importance
हूँ
of
क्या
it.
करें
So all this while in all the various other questions also that we have spoken before of, we everybody has individually stressed at some point in time that what is the role of life and
आप
lifestyle
कर दो मैं
modification.
यहाँ
So
पे
of course
कैसे
it carries
दोबारा
a huge and
आप
a
वहाँ पे फोन
massive
करके
role
वाइफ
not
को
only
कॉल
in terms of
करके
liver health but overall health per se. I talk about.
हाँ उसको बोलो जल्दी से आए यहाँ पे क्योंकि मैं आई का
Thank you, sir. So, Dr. Bhogal, how can people support liver health advocacy and awareness efforts, including the World Liver Health Day and other such activities in their community?
See, the type of activity we are doing right now is very important for us, and I think it should be public rather than discussing between the doctors. It's more important to discuss such issues in public so that public becomes aware of it. And we have to motivate patients for screening. That's very important. Sometimes we just get to know about the patient who's hepatitis B or C positive just by screening. If we emphasize on regular screening in the form of liver function tests, we can find a lot of cases at early stage. Of course, ultrasound helps, and nowadays fibroscan is a very important equipment which is helping us, because certain patients in which we are not sure whether they are, how much fibrosis is there and how much fatty involvement is there. So this fibroscan helps us a lot. So I think we have to make people aware of the screening, which is more important. Because in India, people come to us when they've already fallen sick, whereas we should emphasize that in liver cases, it's a screening which is more important, because that's how we can sometimes find the hidden cases which are not overt in the symptoms. And endoscopy, of course, definitely helps in certain cases again.
Oh, thank you, sir. So there's a question on chat box being asked by Mr. Sumit Kumar. He's
I'm
asked.
okay now.
Okay, so thank you, sir. So I would want you to answer this question, sir. This has been asked from Mr. Sumit Kumar. He's asking ki, pain on my right upper quadrant. Ultrasound shows hepatomegaly with grade 1 fatty liver, SGOT 40 and SGPT 80.
Well, if you have a pain in the right upper quadrant, uh, the liver enzymes are not very high. It could be due to fatty liver, but I would want to make sure I rule out other things. I want to make sure there is no biliary stones or any cholecystitis. Number two, this patient has a chronic liver disease. I want to make sure there is no hepatitis. That is basically the pain can come like that. We need to see the absence of the liver, any kind of habits they are not. Uh, the first thing would be to make sure there are no stones. If everything is knocked out, then you will treat the pain, you will do the chronic screen and find out what's going on. And if there is a suspicion of any stone or so, you can do an MRC.
Okay, so thank you, sir. And this is the question to all. Like, what are the key takeaway or messages you all want to convey to the audience about liver health and liver disease? And I would like to start with Dr. Ankul first.
Takeaway, of course, is to check on your alcohol intake. Medically speaking, no amount of alcohol intake is recommended to be a healthy intake. But yes, as a social thinking, I think most of us at some point in time indulge into it. So it's very important for us to check the frequency of it and how much we are consuming at one given point in time. And of course lifestyle, when it lifestyle is a very broad term, so it takes care of both the diet and the as well as the physical activity depending upon the age and the sex of the person we are talking about. So keeping a liver healthy is not a very difficult task if we just follow very simple things, keep our alcohol intake in check and keep our diet and physical lifestyle in check. Most of the people will not land up with liver problems as such.
Dr. Vishal?
Yeah. So, what I can suggest is if you are overweight or obese, try to cut your body weight gradually and try to come within the standard BMI, so that you will not progress from fatty liver to advanced liver fibrosis stage. And if you are not able to give up your alcohol, at least curtailing the amount of alcohol will help your liver a lot. Ideally, you should slowly and gradually wean off from your alcohol intake, but try to restrict to bare minimum. And at least you should do physical activity. If you are functionally okay, you are able to walk, start your physical activity. Maybe you can start from brisk walk only. If you are doing a sedentary lifestyle, start from 5,000 steps per day. If you are regularly doing 5,000 steps, you can increase your physical activity to 7,000 steps, and gradually you should increase to maintain at least 10,000 steps per day, so that your apart from keeping it healthy, your liver healthy, it will help to reduce many more diseases as well.
Thank you, sir. So, Dr. Harsh,
Yes.
yeah. So, any take-home message or you want to share with the public?
I will not repeat what my colleagues have already said. What I would say that I would like to add one more thing. As liver is a very forgiving organ, it's a big organ. You see the problems at a very late stage clinically. An yearly checkup of everybody, a basic physical examination and a PhD done would probably elaborate at a very early stage a lot of problems which we can pursue and probably do much for those then discovering them 10 years and cirrhosis have engulfed it. That would be my message.
Thank you, sir. So, Dr. Vijay, from your
Yeah,
side, sir.
uh, everything is well said by my senior and friends. So I would say in simple language, खूब पैदल चलना, पानी ज़्यादा पीना and परहेज करना.
Thank you, sir. Dr. Bhogal?
Most of the points have already been covered, but I would again re-emphasize on screening. Like if a person wants to enjoy his social life, drink every alternate day or weekends or whatever his lifestyle is, then I think he should spend some time and efforts and money in getting screening as well as done at least once in 6 months so as to know where his liver status is and act accordingly.
Thank you, sir. So there is a one more question on chat box, and he is asking कि मेरा लीवर enlarge बता रहा है, मैंने सोनोग्राफी की थी, उसमें बताया लीवर में सूजन होने से लीवर enlarge हो रहा है. प्लीज सजेस्ट मी कि मुझे कोई टेस्ट करवाना पड़ेगा लीवर से रिलेटेड. सो एनी ऑफ यू प्लीज.
Yes, sir.
या डॉक्टर हर्ष प्लीज.
Uh, First of all, having a mention that liver is enlarged on ultrasound, it is a very deceptive thing. Because when you take a deep breath, the liver will go down. When you take it, exhale, it will go up. So measurement of liver is not a good scale on the ultrasound. All said and done, if you have that, the next step would be liver function to figure out whether you have fat there, if you have more stiffness. You do a complete liver profile, and if it is a normality to see the oils markers, viral markers are negative, and the SDLT is high. Look into your alcohol habits. If that is not an issue, you will have to go for a complete chronic liver screen, including antiviral, metabolic, and autoimmune causes.
Oh, so thank you, so thank you, everyone. Thank you, audience, for joining us today as we conclude this
Thank you.
Facebook Live session on the occasion of this World Liver Day. We hope that our esteemed panelist has provided with you with valuable insights and information on liver health. It is crucial to take care of our liver as it plays a significant role in maintaining our oral health and well-being. We thank our panelists,
Thank
Dr.
you.
Harsh Kapoor,
Thank
Dr.
you very much. Yeah.
Dr.
Thank you.
Vishal, Dr. Vijay, and Dr. Jatinder Bhogal for sharing their expertise and knowledge with us today. We also thanks all the viewers who joined us for this session and hope that the information shared here will be helpful to you. Remember, a healthy liver is a key to healthy life. Thank you, sir. Thank you.
Thank you
Thank
very
you
much
all.
for
Thank you.